The knee is one of the most common areas of injury for the modern athlete. From acute injuries like torn ACLs to more chronic ones like patellar tendonitis, the world of sports is riddled with career-ending knee pain. But why has this happened? Are humans just not made to move the way that we move when we're playing sports? Of course we are, but our lifestyles and training habits have moved us away from strengthening the parts of our bodies required to perform these dynamic tasks repeatedly. You may not currently have any knee pain, which is great, but whether you do or you don't. Let's find out with a few tests if our bodies are able to function as they need to in order to prevent injury, and after that, I'll show you some ways to improve to increase athleticism and quality of life. So the knee is responsible for flexion and extension of, well, the knee, the midway point of your leg, which is clearly necessary for many of the movements we do in our daily lives, and especially the movements we do in our sports. So the first test we're gonna do is the couch stretch. And you can perform this test either on a pad on the ground or on a couch. You want your knee touching the ground and touching the wall or the back of the couch, and you want to lean back until the gap has completely closed between your heel and your butt. So they're completely touching, there's no gap. You couldn't slide your hand between your back and your leg. Your butt is touching your heel and your shoulder is touching the back wall. If you're not able to get here comfortably without extreme stress or strain on either the quadricep or the hip flexor, then it's okay, but you failed this test. If you are able to sit here comfortably for 30 seconds, then you passed. The next test is the reverse Nordic. So here you're gonna want to sit on the ground on your knees, widen your knees and ankles just slightly past shoulder length so that when you go down backwards, you're able to touch your back to the ground and then move back up. If you're unable to do this without pain, then you failed this test. If you are able to do this pain-free, even if it may be difficult, you pass this test. Next, we have the sissy squat. So for this one, you're gonna wanna just stand straight up and then lean forward with the hips and the knees all the way until your knees touch the ground, move down slowly and move back up as slowly as possible. If you're able to maintain balance and perform this pain-free, you pass this test. Otherwise, you failed. That's okay. Don't get discouraged if you fail any of these. Stick around and I'm gonna help you fix them later in the video. We've got a few more tests left. Next, we have the 10-minute squat test. Now this one's quite simple. You can do this on the flat ground, or since we're testing the knees and not the ankles today, you can do this on a slant board or an incline so that you can comfortably get into the squat position. If you can sit in this squat position for 10 minutes, don't worry about perfect posture, let your back be relaxed, just focus on staying down for 10 minutes, then you pass. If you're losing blood flow or your knees start to hurt pretty badly, go ahead and stand back up. You failed this test. Never push past pain. So if you failed any of these tests, you're probably wondering, how did this happen? Why is my knee not able to function properly? Well, it's not from overuse, it's from improper use. A lack of full functionality of the knee is what leads to injury, not overuse. You can't use the body too much unless you haven't prepared it properly to be used as much as you need to. So if you currently have knee pain and you weren't able to complete these tests without pain, do not be afraid. These next exercises will help you fix your knee pain and get back to your sport, or if you're not an athlete, your pain-free life. If you aren't yet injured, but you failed any of these knee tests, you'd better be grateful. But now that you know what your knees should be able to do, you can take these next steps to bulletproof them going forward. Follow me. If you're severely injured, if you have patellar tendonitis or any other stiffened up scar tissue, you're gonna wanna do this first, and this may be all you can do right now, and that's okay. Walk backwards. It's very low impact, but it increases the blood flow to your tendons to stimulate the healing process once again. If it's laid dormant for too long, it hasn't healed. It's just sat there, and you've actually just lost muscle and tendon strength. So you're gonna wanna start just by stimulating it slowly with a backwards walk, but this has to be done daily to stimulate the growth once again. Then we can move into the Patrick step up, coined by none other than Ben Patrick, knees over toes guy, which is shown here. You want to keep the foot flat on the ground, stick the other knee in front and move forward with the hips, not into a squat position, but moving forward to place the strain on the patellar tendon and the quadricep, not the glutes. The next step would be the Poliquin step up, which is standing on an incline and performing the exact same movement, shifting the hips forward to place the strain on the quad and the knee tendon. The next step in this progression would be the Peterson step up, where we're not on an incline itself, but we're elevated with some steps or some books, and then we are manually creating that incline by starting flat on our foot, and then as we move down by lifting onto our toes. This is going to increase the stability of the ankle and the knee while increasing the blood flow and strength of the patellar tendon by placing the stress on that tendon as well as the quadricep. Next, we have reverse Nordics for reps. Now, if you failed the reverse Nordic test, you probably can't do these quite yet, but the other exercises are going to strengthen your quads and your tendon to be able to move into this. If you're able to go down on the reverse Nordic, do that. Do the eccentric for reps and don't worry about the concentric or moving up. Just move down slowly and then reset and move down slowly once again on the next rep. But make sure you're not doing this unless it's completely pain-free. Next, we have the VMO squat. So this exercise is going to work on the VMO, or the vastus medialis oblique, which is one of the 4 quadricep muscles that is most responsible for protecting and bulletproofing the knee. It's often neglected because we don't normally get into positions like these. So with this VMO squat, you're going to really focus on dropping down and keeping the knees in front of you. Don't drop down like a squat, but drop down while keeping the back upright. If you can't do this without a slant board, you're most likely going to need an incline to be able to do this properly. So elevate the heel as much as is necessary to be able to move down in this position. As you drop, your elbows should touch your hip flexors with your knees far out in front. Completely close the gap between your calf and your hamstring so that you're in a full knee bend position. Focus on the eccentric moving down and then explode up if possible. Do not do this if there's knee pain once again. Focus on the walking backwards and the step ups until your tendon has healed enough to be able to move into these lengthening exercises. Next, we have the sissy squats. You can obviously perform these for reps to really bulletproof the tendon, but it's more of an advanced technique that I would not recommend to anybody dealing with knee pain, as it will be difficult and places a lot of stress on the tendon. Next, we have the ATG split squat, which is great for the bulletproofing of the knee and strengthening of the quadricep muscles while also lengthening the hip flexor at the same time. You're gonna wanna step into a regular lunge position, but then widen your stance even further so that when you move down into the split squat, your knee is far past your toe, pretty much in the same position as it would be for the VMO squat, but it's just one leg and the other one is stretched out behind you on the toe. The goal of this is to keep the heel on the ground, but if that's not possible, it's okay to lift the heel off. You want to focus more on getting the full bend in the knee and closing the gap between the calf and the hamstring. Keep the lower back at a posterior tilt without moving into anterior tilt, because this will put tension on the lower back while relieving some of the stress on the hip flexor, which we don't want. If our hip flexors cannot yet get into this position, you can regress into it elevated, and you can also regress if there's still knee pain. Elevating decreases the stress on the knee as well as the hip flexor, so you can start at any level until you eventually move into on the floor and even loaded. Next, we have the progression into the 10-minute squat. You're just gonna wanna squat every single day. Get into this position until you can't anymore. Once you feel like it's getting painful or stiff, you can stand up and do it again the next day. Eventually, your connective tissue will adapt to being in this position and you'll be able to sit there comfortably for at least 10 minutes without any pain at all. And then finally, we have the couch stretch. Just as the very first test we performed, this is gonna increase the length of the quadricep as well as the hip flexor muscle to enable us to get into these positions and loosen the amount of stress and strain on the patellar tendon. If our quads and hip flexors are tight, since the whole body is a system of pulleys and everything is connected, that's tight, it's pulling on the tendon, which is gonna cause undue stress that'll lead to tearing and injuries. You're gonna wanna do the shorter range exercises like the step ups or the backwards walks daily if at all possible, and perform the longer range ones like the reverse Nordics and the squats twice per week so that we're not intensely loading the connective tissue too often, as it does have an increased recovery time when compared with muscle. Now, these exercises will completely transform your knee health, but the body's a complex system, so we can't rely on isolating one part of the body to improve our overall health and performance. So before we should really even touch the knees, we need to make sure that our ankles are ready to do their job properly. So check out this video next to learn how to bulletproof the ankles and strengthen your athletic foundation. If you liked this video and you found it helpful, go ahead and obliterate the like button, subscribe, and comment down below which of the knee tests you passed or failed. I'll see you over there. Go be human.